Hi, my name is John Moore and I'm presenting my project proposal for 892, College of Nursing for Eastern Kentucky University. My project is Modified Cognitive Behavioral Therapy for Children with ASD, Autism Spectrum Disorder. This is a clinical nursing problem because autism spectrum disorder affects social, communicative, cognitive skills that causes difficulty adjusting to changes in the environment. Anxiety is one of the most frequent comorbidities that children with ASD present with that impacts their school, relationships, and family functioning that negatively affects their quality of life. This further leads to deficits in social awareness, cognition, communication, motivation, and mannerisms that affect their ability to perform daily routines. Background and significance. CDC indicated that in 2010, 1 in every 68 children age 8 was diagnosed with ASD. Treating anxiety early on is imperative. The National Institute for Nursing Research's priority is to improve the quality of life by managing symptoms that are acute and chronic. Autism symptoms that are expressed in childhood will further increase as the child gets older into adulthood. Storch and Wood developed randomized control trials that show that high-functioning ASD children benefit from CBT that is modified for the ASD child. My proposed method is to develop a randomized control trial of modified behavioral interventions for anxiety in children with ASD, known as BIACA, to 50 high-functioning ASD children with significant clinically anxiety to either 90 minutes of BICA for 16 weekly sessions or to treatment as usual in an outpatient mental health clinic. The population will be, for the modified cognitive BICA, will be children between the ages of 7 to 16, diagnosed with ASD, have an IQ of 70 or above, diagnosed with clinically significant anxiety disorder of the GAD, OCD, SAD, SOC, and if on medications, they have to be controlled for at least 8 weeks. Children's anxiety and level of functioning will be measured at baseline, post-treatment, and at 3-month follow-up, with the measurements of ADISCP, PARS, and the SRS test. Children and parents will be given a satisfaction survey at the end of the 3-month follow-up. The goal of the study is to improve high-functioning ASD school-age children's quality of life by decreasing anxiety level and improving autism functioning outcomes such as improving social awareness, cognition, communication, motivation, and mannerisms. In Table 1 here, you will see a description of what will happen in each therapy session from week 1 through week 16. In Table 2, you will see a timeline that will happen in the study and the events that will take place. Results and discussion. So the study will show 50% response rate of decreasing in clinically significant anxiety, 35% remission status from primary anxiety diagnosis at post-treatment, retention kept at 3 months by 75%, 75% satisfaction rating among children and parents, and the SRS showing an improvement in autism functioning of awareness, cognition, communication, motivation, and mannerisms by at least 35%. So implications and conclusion for nursing practice. There should be an increase in parental involvement, exposing children to fears outside the clinic, exposing them to real-life situations, develops a reward system, teaches parents to support the child to help them gain independence, children decreasing their anxiety level, parents learn to support through positive reinforcement and help them with communication skills to encourage their child's independence. Children learn to develop friendships and social skills, gain confidence and independence. There is a high satisfaction rating, and overall, the BICA has shown to decrease anxiety, improve social cognition, motivation, communication, mannerisms, which improve the ability to perform daily activities and functioning. This is done by helping children establish cognitive restructuring, exposing them, and overcoming their fears by establishing social skills. I want to thank everyone for listening to this presentation, and I want to thank the College of Nursing. I also want to thank my professors, and I want to thank my fellow students. Thank you so much.